And now it's my very great pleasure to introduce Dr Mathew Pase, who is a Senior Research Fellow at the Melbourne Dementia Research Centre at the Florey Institute and the University of Melbourne. Dr Pase is also a Senior Research Fellow at Swinburne University and an Assistant Professor of Epidemiology at Harvard University. Clearly he does quite a bit of travelling. His research is focused on understanding risk and protective factors for cerebrovascular disease, brain ageing and dementia. He's an investigator on many large international cohorts and initiatives, including the Framingham Heart Study. Dr Pase is funded by a National Heart Foundation of Australia Future Leaders Fellowship, as well as grants from the NHMRC, Alzheimer's Association, Bethlehem Griffiths Research Foundation, Stroke Foundation, and the US Institute on Ageing. At the Florey, Dr Pase leads a lab with Dr Yen Yin Lim, where they run the Healthy Brain Project, a large community-based initiative that aims to understand optimal brain health and ageing by following Australians over time. And with that, I will hand over to Dr Pase. Thank you.
Hi, thank you all for coming out this evening, and thank you for that introduction, Melanie. So I'm going to talk today about lifestyle and its potential role in preventing dementia. So my talk's going to be in about 5 sections. So I'm going to talk about dementia, what it is, how it's different from Alzheimer's disease. I'm going to talk about the different causes of dementia. And then I'm going to talk about some really interesting data which suggests that dementia risk is malleable. In other words, it seems to be changing over time, and this might have implications for how we go about preventing dementia. And they're going to talk about lifestyle and how lifestyle might relate to dementia. And there's so much we could talk about in an hour, so I'm really just going to focus on a few specific things, including sleep, vascular health, as well as diet. And then I'm going to make some conclusions. So we know that the population is aging, and this is really something that's tremendous, and we should be celebrating it. It's due to many things, including huge advancements in medical care and medical research. But it does create new challenges for us as researchers. So for example, with now people living beyond cardiovascular disease, living beyond cancer, people are living into old age where we're seeing more and more cases of dementia. And so dementia is becoming a growing problem for our society. And it's one of the leading causes of death, both in the United States and in Australia. But actually, dementia is not just a problem for high-income countries. It's actually a problem across the globe, and it's becoming more of a problem. We estimate that by the year 2050, there will be 132 million people living with dementia globally, and 68% of that burden will be in low to middle-income countries. That is, countries that are less able to deal with this increase in demand. So really, I think tackling this growing problem for society requires a global call to arms and urgent action as well. Now, often when I talk to people from the community, I hear a little bit of confusion about what is Alzheimer's disease, how is it different from dementia. So I'm going to take just a little bit of time to explain these terms. So dementia essentially is an umbrella term that we use to describe a syndrome. It's a collection of problems associated with a deterioration in thinking and sometimes often memory. And it's severe enough to impact an individual's ability to go about their everyday life. So some degree of forgetfulness, for example, can be expected with aging. But in dementia, it's quite severe, and it does impair an individual's ability, say, to do the everyday things that they enjoy, as well as the things they need to do to function, such as pay their bills, have a job, etc. Now, there are many different causes of dementia, and Alzheimer's disease is the most common. Alzheimer's disease is associated with the buildup of 2 proteins in the brain that become abnormal. One is called amyloid, and the other is called tau. And this leads to essentially death of brain cells. And these brain cells, as you lose them, your brain shrinks, and this impacts people's ability to think and to remember. But Alzheimer's disease is just one of many causes of dementia. And in fact, there's many more than I've listed here. But here are just a few of the most common. So vascular dementia is the second most common form of dementia. And this is due to dementia from a series of strokes, but also it can be due to disease of the blood vessels in the brain as well. Other common causes are things like Lewy body dementias, frontotemporal dementias, but you can also have dementia due to, say, Parkinson's disease, to repeated head trauma, and to other things as well. Now, interestingly, although we tend to diagnose dementia based on how someone presents in a clinic, and we tend to say that dementia is due to one thing or another. So typically people are told they have a diagnosis of Alzheimer's disease dementia, for example. But when we look at the brains of people who have died with dementia, what we typically see is that people have evidence of multiple things contributing to their dementia. In other words, it's very common for people with dementia to have multiple causes, such as Alzheimer's disease and vascular dementia, or say Alzheimer's disease and Lewy bodies. So it's a very, very complex picture that makes doing research in this area tremendously difficult. Now, this sort of describes what thinking and memory looks like across aging. So you can see in the solid black line, you've got this change over time, this change with age, whereby there is some decline in thinking and memory that takes place. But it's subtle and it's not huge. Whereas in the dotted line, you can see the changes in thinking and memory that are typical of dementia. And you can see that it's much more steep. And so dementia is not a consequence of aging. It's something that's different from the aging process. And what we know now is that dementia has a very, very long preclinical phase. In other words, by the time someone comes to a clinic and has thinking and memory problems, the processes in their brain that are contributing to dementia have probably been accumulating for up to 10, 20, even sometimes 30 years. And this means that if we want to really think about preventing dementia, we need to take a lifespan approach and not just concentrate on old age. Certainly there are people trying to develop drugs and therapies that can be beneficial in the late stages. But I think at a global level, we also need to be thinking about what young people and middle-aged people can be doing to protect their brain as they age into old age. And so as yet, we don't have any drugs to prevent or permanently halt dementia. And so my research is partly focused on trying to understand risk as well as protective factors that we could leverage to help people reduce their risk. Everybody's risk of dementia appears to be declining over time. In other words, the absolute number of people living with dementia is still increasing because there are more people today than there were yesterday, and next week there'll be even more people. But everyone's risk appears to be changing. In other words, my risk of dementia is lower than that of my parents, and my parents' risk of dementia appears to be lower than my grandparents. And I think this is very, very interesting, and it provides some cautious optimism because it suggests there might be factors out there that if we could better understand, we could leverage to try and reduce dementia risk even further. So I'm going to talk about a number of different lifestyle factors, as I mentioned. There are so many things we could talk about, and I'm just going to focus on some of the ones that are sort of more interesting to me and that I've done more research on. So the first thing I'm going to focus on is the role of poor sleep in dementia. So as we age, there's this change in sleep time that occurs. All parents will be familiar with this, that a newborn spends most of their time asleep, and that this sleep need gradually changes with aging. And there's been quite a lot of research simply looking at sleep time and how long someone sleeps and how this relates to the risk of dementia in the future. And people have sort of seen that both long sleep time and short sleep time might relate to a higher risk of dementia. And this is something that we've investigated, and I'll walk you through those results. So for this study, we looked at people in what's called the Framingham Heart Study. This is a very large, ongoing, community-based study just outside of Boston. It's actually one of the largest and longest ongoing medical studies. It started in 1948 and still going today, following thousands and thousands of people over time for all kinds of things, such as heart disease, stroke, as well as dementia. And in this study, we simply asked people to tell us how long they slept, and then we followed them for 10 years and saw who developed dementia and who didn't. And what we found was that people sleeping more than 9 hours a night had a twofold increase in their risk of developing dementia within 10 years. But actually we thought this might be a bit surprising. What would the mechanism be? Why would long sleepers be at a higher risk of dementia? So we went back in time. This is Framingham. It's been ongoing since 1948. We went back into the data and looked at how people were sleeping in the past. And what we found was that those people who were always long sleepers didn't have an increased risk of dementia. However, those people who once upon a time had normal sleep and then all of a sudden found that their sleep was changing and they started sleeping for very long periods, these people had an increase in their risk of developing dementia in the future. And interestingly, we didn't find an association with short sleep time. Those people who slept for a short amount of time didn't have an increased risk of dementia. But those people who said they had some problems with their thinking and memory, this was them telling us, not us actually measuring it, people who reported problems with thinking and memory, and who also recently transitioned to becoming a long sleeper, had a six times increase in their risk of developing dementia. And we did a number of analyses which actually suggests that sleep time wasn't a risk factor per se, but actually a marker. In other words, in some people who are near to getting dementia, their sleep needs appears to change as their brain changes with the really early stages of dementia. In other words, we're not suggesting that people restrict their sleep. That's unlikely to have an effect. But it's also important to remember that these are data based on averages. They don't apply for everyone. But certainly, if you're noticing big changes in your sleep and you're also starting to notice problems with your thinking and problems with your memory, it might be worth getting a checkup from your doctor. So in that study, I mentioned that sleep time might be a marker of something happening rather than a risk factor. But actually, other aspects of sleep might be risk factors. Sleep is incredibly important. We all do it. No one gets away without sleeping. And all animals sleep. And one of the really interesting findings to come out lately is that sleep appears to be important for flushing the brain of toxins that accumulate during the day. So this is data from the US. It's not data from me, but it's published in essentially one of the very best science journals. And what it shows is that when the brain is asleep, it's sort of optimized for clearing out metabolic waste, including this protein called amyloid beta, which is one of the proteins that accumulates in Alzheimer's disease. And so in this study, they found that the asleep brain cleared out this amyloid beta twice as fast as the awake brain. And so we thought, well, perhaps based on this might be one of the functions of sleep. It might help to sort of restore the brain as you sleep. Again, more data from the USA. This time they took a group of healthy people and they brought them into the lab on 2 occasions. On one occasion, they let them sleep normally, and on the second occasion, they disrupted their sleep every time they fell into a particular stage of very, very deep sleep. And what they found was that as you disrupt people's deep sleep, you get increases in the amount of amyloid that comes from their brain. In other words, it seems like sleep appears to be very important for clearing out these proteins. And so based on these data, we wanted to look at the relationship between sleep quality and the different sleep stages and how it relates to dementia. So as you sleep, you cycle through different stages ranging from very light sleep through to deeper sleep, and then a stage called REM sleep, which is where you have rapid eye movements, and it's a stage we associate with dreaming. And so for this, we did a sleep study on 321 people and then followed them up for 10 years to see who developed dementia. 12 years of follow-up, not 10. And what we found was that as people's REM sleep decreased, as their dreaming sleep decreased, each percentage reduction in REM sleep associated with a 9% increase in their risk of developing dementia in the future. We also found that people, when they went to sleep, who took longer to enter REM sleep, had a higher risk of developing dementia. And people who had more arousals from sleep, in other words, their sleep was more fragmented, they woke up more times during the night. These people also had an increase in their risk of dementia. And we're now building on these data. We're generating more and more data. And we've also got data on multiple sleep studies, so tracking people's sleep over time. And what we're seeing now is that as people's sleep deteriorates, those that have more deterioration in sleep quality, these people do have an increased risk of developing dementia in the future. And these data are observational, meaning we observe that sleep is related to dementia, but we can't necessarily infer cause and effect. But nevertheless, we know that sleep is important for many, many factors in health, and so it makes sense that you would want to optimize your sleep. And there are some things that you can do to improve your sleep. One of the most important things is to make sleep regular. In other words, setting regular bedtimes and regular wake times is quite important, and keeping that consistency across the weekday and weekends also seems to help. It's also important to expose yourself to light at the right time of the day. So light is very important for regulating what we call your circadian rhythm, in other words, your body clock. And if you get light late at night, you will shift your body clock, you will delay it, and it will be harder to go to sleep. If you get bright light early in the morning, you will advance your body clock and you'll tend to wake up earlier. So it's important to get light at the right time. For example, reading off a Kindle or a laptop late at night with a blue light shining on your face will delay your body clock a little bit. It's also important to set bed boundaries. So it's good not to associate your bed with a place of stress and anxiety. In other words, it's bad to sit on your bed with your laptop doing work because it creates a stressful environment. And when you go to bed, you'll start thinking of work unconsciously. So reserve your bed as a place of sleep and rest, and obviously also a place you can be intimate with your partner, but try not to create a space that's stressful. Also, obviously make your sleeping environment comfortable. So it should be ideally a little bit cooler, it should be dark and quiet. Okay, the next thing I'm going to talk about is cardiovascular health. And this is really where I've done most of my research over the years, and how cardiovascular health affects the brain and affects risk of dementia. So here at the Healthy Brain Project at the Florey, we've got some exciting data coming out showing that people who have more cardiovascular risk factors, that is, more risk factors for getting heart disease, things like obesity, diabetes, high blood pressure, these people have a higher risk, these people have poorer cognitive function. And that's shown here. So if you look at people who have 2 cardiovascular risk factors or more versus none, these people tend to have poorer memory performance. And these are healthy people aged 40 to 70. These are not people with dementia. And these are findings that are sort of consistent across many studies over the world. For example, we did some research in the USA looking at what's called the Ideal Cardiovascular Health Index. So this is a metric developed by the American Heart Association. And what it does is it places the emphasis on ideal cardiovascular health rather than risk. So people get a score from 0 to 7, and 7 is ideal and 0 is not so ideal. So for example, if you're a non-smoker, you get 1 point. If you've got optimal cholesterol, if you've got a good BMI, that is, you're not obese, you get points. If you've got optimal blood glucose, if you've got regular physical activity that meets guidelines, you get another point. If you've got optimal blood pressure, you get another point. And then if you have a healthy diet, you get another point as well. Excuse me. And that includes things like sufficient intakes of fruit and vegetables, avoiding sugary beverages, avoiding excess sodium, eating fatty fish, and also eating fiber-rich whole grains. If you do all those things, you get a score of 7. Now, in the community, it's very rare to see someone with a perfect score. But nevertheless, try and aim for as high a score as possible. And we've seen across studies that those with higher scores have a lower risk of going on to get heart disease. Now, in the Framingham Heart Study, we wanted to look at, well, what is the relationship between these heart risk factors and people's brains? And so for that, we studied almost 3,000 people who were free of stroke and free of dementia. We looked at their ideal cardiovascular health scores and then followed them up over time. What we found was that those people who had higher ideal cardiovascular health scores had a lower risk of going on to develop stroke, but they also had less decline in thinking and memory, including less cognitive decline on tasks of visual memory, in other words, memory of visual objects, as well as reasoning. So people who had higher scores had less decline in their ability to reason over time. And we also found that people who had higher scores had less shrinkage of their brain. And in particular, they had less shrinkage in the front of their brain. And this is an area we know is very important for abstract reasoning, for judgment, and for planning. And so based on these data, we thought that, well, it seems like what's good for the heart is good for the brain, and maintaining ideal cardiovascular health might help preserve the brain as you age. You know, the brain is a very thirsty organ. It requires a constant blood supply. And any disruption to that blood supply can create problems for the brain. So it's very intuitive that a better heart would equal a better brain. In this study, we also looked at how people's ideal cardiovascular health related to their risk of developing dementia. And for this, we focused on people older than 60, because we know that dementia is rare in younger people. So for this, we followed up just over 1,300 people for 10 years. And we found that those people who had higher ideal cardiovascular health scores had a lower risk of getting dementia. And that was including vascular dementia, so dementia due to vascular disease, but also dementia due to Alzheimer's disease as well. And again, more data to suggest that maintaining a healthy cardiovascular system helps preserve your brain integrity into old age. But what we're also seeing is it's very important what people do for their heart health earlier in life. So this is just a diagram to illustrate that if we take a group of people with a mean age of, say, 42 years, and we look at those with hypertension, high blood pressure, and those without, those people with high blood pressure, their brain looks about 7 years older than those without high blood pressure. Whereas if we take an older group with a mean age of 62 years, those with high blood pressure, their brain looks about 2 years older. In other words, it suggests that vascular health and your heart health is important for your brain at younger ages than we previously thought. This is data showing the relationship between vascular risk factors, things like obesity, diabetes, high blood pressure, and the aggregate of them, all of them combined together, and their relationship to brain volume. And what you're looking at here is each vascular risk factors in relation to brain volume at different ages. And lower scores indicate a stronger relationship. So the lower you see the line on that graph, the stronger the relationship between vascular health and brain health. And you can see that it changes quite a lot over the lifespan. In other words, it seems to be stronger in younger people as compared to older people. And it's still there in older people. So it's still very important what older people do to improve their cardiovascular health. But I think the message also should be young people should care about their heart for their brain health in old age, because clearly what people do in midlife does influence what their brain looks like in old age. And in fact, if we take people and we look at their brains on MRIs at age 85, their vascular risk factors that we measured at age 30 or 35 or 40 do relate to that brain health that we see. So for example, this is a study that we had published just last week actually, looking at the relationship between vascular risk factors in midlife and the brain on autopsy in old age. And what we see is that if you look at people's risk factors 33 years before they die, those risk factors do predict how much disease of the brain we see under a microscope. So clearly, there's this long latency period, and what people do earlier in life is very important. We've also done research looking at physical activity and how physical activity relates to brain health. So these are data looking at how people's physical activity relates to their brain volume, and we take brain volume as a sort of aggregate marker of people's brain health. Those people with larger brain volumes relative to their head size have less shrinkage of their brain over time. And what we find is that each additional hour of light intensity physical activity associates with larger brain volumes, equivalent to about 1.1 years of brain aging. And what was really interesting was that we observed this association even in people who didn't meet physical activity guidelines. In other words, everyone's trying to meet these physical activity guidelines, but for some people it's not possible. They might have injuries or commitments that prevent them from doing so. And these data are promising because it suggests that anything is better than nothing. Doing some physical activity seems to be good for the brain. Recently also, again, this is last week, published in the Lancet Neurology, this looks at data on people's treatment for high blood pressure and how that influences risk of dementia. And so what we did was we took 31,000 people living in the community across the USA and Europe, and all these people had high blood pressure. And we compared those who were taking medications to lower their blood pressure versus those who weren't. And what we found was that those people taking medications to lower their blood pressure had a lower risk of going on to develop dementia. And what was very interesting was that there was no difference between the different kinds of blood pressure medications. In other words, it didn't matter what kind of medication someone with high blood pressure was taking, but if they were taking a blood pressure medication to lower down their blood pressure, they had a lower risk of going on to develop dementia. And these data was also confirmed earlier this year by a clinical trial. This trial is called the SPRINT Mind. And what they did was they randomized people to two different groups. So one group was normal blood pressure targets. In other words, they had to get their systolic blood pressure to 140 or less, whereas the intensive blood pressure group had to get their blood pressure to 120 milliliters of mercury or lower, so much lower blood pressure target. And those people with more aggressive blood pressure treatment had a lower risk of going on to develop what we call mild cognitive impairment. In other words, cognitive impairment that's not quite dementia, but still more than expected based on someone's age. So the last aspect of lifestyle I'm going to focus on is that of diet and poor diet. So I did my postdoctoral training in the USA, and one of the first things I noticed was just how prevalent sugar intake was. I mean, sugar seemed to be in everything. You know, coming from Melbourne, spoiled with good bread and things like that, and then all the bread in the USA tended to taste like a donut. And you know, I found this quite interesting because it was just so prevalent in the society. And you know, Australia's not much better. We also have high intake of sugars. But based on the data I presented earlier, you know, high cardiovascular risk and poor heart health associates with poor brain health. We know that excess sugar relates to diseases like obesity, diabetes, etc. So perhaps the things that people eat, including excess sugars, might also relate to their brain and their brain health. So in this study, we looked at people's sugary beverage intake and how that related to their brain health. And we looked at sugary beverage intake as a sort of proxy for overall sugar in the diet. It's very hard to quantify how much sugar someone has overall. Because you know, I can ask you what you ate and you might tell me, oh, last night I went to my sister's house and she made this. But from that information, it's very hard to derive how much sugar you had. Whereas people are very good at recalling typically how much sugary beverages they have. So for example, I typically drink a Coke a day or a Coke a week. And this is a major contributor to excess sugar in the diet. So in this study, we looked at sugary beverage intake and brain volume on MRI, as well as thinking and memory performance on cognitive testing. And we studied just over 4,000 people. And now if you look on the left, what you can see, is that those who have higher intakes of sugary beverages have lower brain volumes. And on the right, you can see that those with higher intakes also have poorer memory performance. And this is a task called logical memory. So people with more intake had poorer performance both immediately, so recalling more aspects of a story straight away, as well as poor recall down the track as well. And what was really interesting was that it wasn't just things like soft drinks and Coke that drove this association. Even people with higher intakes of fruit juices also showed these same effects. So people who took more fruit juice had lower brain volumes and poorer memory as well. And that might seem counterintuitive, but fruit juice is actually a very big contributor to excess sugar in the diet. So for example, you know, if I was to put a bowl of apples in front of you, you would probably only eat one, if any, maybe two, but then you'd be full and you'd stop because apples are very high in fiber. But if I was to give you apple juice, you could easily drink all the sugar from 5 apples and you wouldn't be full because there's no fiber and you're just getting lots and lots of sugar. So we even see that people with high fruit juice intake tend to have these associations as well. In a follow-up study, we wanted to look at the relationship between sugary beverage intake and risk of stroke, as well as risk of getting dementia in the future. And for this, we followed people up for 10 years. And we also measured beverage intake multiple times over that period. And we studied about 3,000 people for risk of stroke and about 1,500 people for risk of dementia. Now, to our surprise, we didn't see any associations actually between sugary beverage intake and risk of stroke or risk of dementia. But to our great surprise, what we did see was that those people with higher diet soda intake, I speak like an American, diet soft drink intake, had a higher risk of developing dementia. And you know, to us, this was very surprising. And actually, when we started looking at the literature, it actually sort of emerged that you know, this is an association that hasn't been shown for stroke or dementia, but has been shown for other vascular things. So for example, people with more intakes of diet sodas tend to show that they've got higher cardiovascular disease risk. Now, I'm not here to tell you that this association is necessarily causal. There could be many, many things that explain it. So for example, perhaps people who go to their doctor who are unwell, they've got diabetes, they're obese, the doctor says, you need to get off the sugar. So they switch to diet soft drinks, and now we see this association between diet soft drinks and stroke and dementia because these people are generally unwell, rather than anything they're consuming. But nevertheless, it's a very intriguing association that now has been shown in a number of studies. And there's some research to show that artificial sweeteners, the things that make diet sodas sweet, change the microbiome, the bacteria in your gut, and that this has implications for different health outcomes. But clearly very early days in research. But rather than sit here or stand here and sort of say, you shouldn't have this or you shouldn't have that, I think it's more intuitive to say, well, what should people be doing to look after their brain as they age? And there's been a number of dietary patterns that have been sort of studied with respect to brain health. The most common one is called the Mediterranean diet. And this is a diet that's consumed typically along the Mediterranean coast. And it includes having olive oil as your primary oil, so not vegetable oil, not butter, not margarine, but olive oil. Having high intakes of fruits and vegetables, having lots of nuts and legumes and beans, having fiber-rich whole grains, eating fatty fish multiple times a week, having red wine in moderation is okay, but poultry is out, red meat is out, snacks and junk food are out, and fast food is also out. And studies have shown consistently, reviews that have looked at all the literature that exists, and these studies have shown that people who have better adherence to the Mediterranean diet have less decline in their thinking and memory over time, and they also have lower rates of developing Alzheimer's disease dementia as well. Now, I know it's very confusing because there are so many diets out there, and it seems like every week there's another diet that's popular. And this is sort of just a snapshot to show you that sort of heterogeneity. So in the middle, you've got the characteristics of the Mediterranean diet, which I described. On the left, you've got a diet which is designed for reducing high blood pressure, called the DASH diet. And on the right, you've got a newer diet called the MIND diet. And this is a diet that was specifically developed in Chicago based on all the evidence we have available today about what factors are good for the brain. And it's very similar to the Mediterranean diet, but actually it's even a little bit easier to follow, which is the good news. So it includes having whole grains in your diet. It includes intake of vegetables, but actually there's a big focus on green leafy vegetables and eating lots of green leafy vegetables, as well as other vegetables. Having berries, because berries appear to be good for the brain based on the research that's out there. Limiting intake of red meat, having fish at least 1 time per week. Poultry is okay. Beans are good, nuts are good. Fast food is obviously out. Olive oil is in as the primary oil that you can use for cooking and eating with. Cheese and butter in limited quantities, and pastries and sweets in limited quantities as well. And alcohol in moderation is okay. And research out of Chicago by the people who sort of came up with this diet have shown that even those people who have modest adherence to this diet, the so-called MIND diet, they have a lower or less decline in their thinking and memory over time. And we've followed this up over time. This is recent data from our group in the Framingham Heart Study showing that those people who have higher MIND diet scores have a lower risk of going on to develop dementia in the future. Also, those with higher scores have better thinking and memory function, and they also have larger brain volumes on brain imaging. So where do we go from here? So we're very interested in characterizing the role of different lifestyle factors in the very early preclinical phases. I mentioned at the start that dementia and Alzheimer's disease has this very long phase by when people come with clinical symptoms, the disease has already been going on for decades. So we're very interested in studying that very early phase to see if we can pinpoint factors that are associated with Alzheimer's disease development and dementia in the future. And so we want to sort of understand what factors are most important, what factors might be most important at different ages. I mentioned some data to suggest that cardiovascular health, for example, was more important at younger ages. And then we're ultimately trying to move towards doing clinical trials to see if we can provide more concrete conclusions around and recommendations around what people should be doing to improve their brain health. And to sort of answer some of these questions, here at the Florey, we're running what's called the Healthy Brain Project. And this is a large initiative, a community-based initiative, tracking the health of Australians over time. And we're very interested in understanding what are some of the factors that are associated with healthy brain aging, essentially. And these are my collaborators and colleagues on the project, Rachel Buckley, Yenying Lim, and Dr Mathew Pase. And we're studying people in Australia aged 40 to 70 years old. Now, the sort of model is that most of the testing occurs online. So people can sign up to the study online. They're given a login portal, and they can complete tests of thinking and memory on their computer. They can also complete information on their sort of lifestyle and general health on their mood. And then we send them a saliva kit, and participants spit in this saliva kit and they return it to us, and we get information on their genetics as well. And we're following these people up over time. And we have people all from Australia participating in our cohort, as you can see here. So far we have about 6,000 people enrolled, but we're aiming to get to 10,000, so we're just over halfway. These are some of the tests that people do as part of our study. So they do things like they answer questions about their general health, thinking and memory tests, etc. And people who complete this study, the Healthy Brain Project, some of them are invited to the clinic here at the Royal Melbourne, where we do more detailed follow-up, including more detailed cognitive assessments. We do brain scans, we do overnight sleep studies, as well as a lumbar puncture to look at biomarkers in the fluid around the brain that we think are important for Alzheimer's disease. And we're following up these people over time. So if you are a participant in our study, we really thank you for your participation, and we really value you coming back to complete your annual assessments so that we can track your health over time. And if you're interested in participating, I'll put up the link at the end. So to summarize, we don't have any drugs to prevent dementia at present, but risk of dementia appears to be changing over time. And the data that we have suggests that Alzheimer's disease is not just a disease of old age, whereas it's certainly not too late to start doing and making healthy changes in old age. I think a lifespan approach is really needed, and people should. The challenge is getting young people and middle-aged people to care about their health so that their brain ages well. And based on these data, it seems like getting adequate sleep, maintaining a healthy heart, and having a healthy diet, obviously very good for general health. It might just help the brain with aging as well. So I'd just like to end by thanking my colleagues and collaborators. First and foremost, Dr. Yen-Ying Lim, who runs the lab with me here at the Florey, as well as Rachel Buckley, Noah Fiasi, and a very, very competent team of research assistants and students, as well as many, many collaborators around the world, particularly in the United States. Thank you for your attention.